Yeah, you're good.
Okay. Usually after you have pneumonia, a respiratory illness, virus, or illness such as the cold or flu, as a complication to that, you get pneumonia. Mycoplasma is another type of pneumonia, and it causes you to have pneumonia. It's very mild, and it's not very common either. It usually affects older children and young adults. Tuberculosis and PCP, pneumocystis carinii pneumonia, it affects those with weakened immune systems due to chronic illnesses like HIV and heart disease, and it also affects, and PCP also is a reason why people can know that they have the first sign of AIDS. PCP is the first sign of AIDS in people that have AIDS. So some symptoms of pneumonia are chest pain, shaking, chills, fever, and you can have a dry cough. We have nausea, rapid breathing, rapid heartbeat, difficulty breathing, and muscle aches. So those guys that lift weights, you might want to watch out for pneumonia. The following can show that there is a medical emergency, and you might want to get to the hospital immediately. You have skin with bluish tone, blood and saliva and mucus, labored or trouble breathing, and a high fever. That's over 103 Fahrenheit. So the doctors usually use the symptoms to help diagnose pneumonia, but there are also some other tips, things that they use. And listen for crackling and bubbling sounds when breathing. This is when you have liquids in your lungs that it's very hard to breathe, so you can hear the bubbles of liquids popping and it's cracking and bubbling. And usually they take a chest x-ray of your lungs and get your lungs, because in a normal lung you can see here that it's all black, but in an affected lung it's cloudy because there's liquids in the lungs. And they also do this thing where it's called bronchoscopy, where they go down the bronchial tubes and see if there's any liquids in there also. So some risk factors for having pneumonia, to get pneumonia, are being under the age of 5 and over the age of 65. Pneumonia really likes to attack those people or those age ranges because your immune system is not as developed as it once was or as it could be. Having a chronic illness such as asthma, COPD, or chronic obstructive pulmonary disease or a heart disease could also be a risk factor for having pneumonia. I know I can associate with this because I have asthma. Having a weak immune system, that can allow you to have pneumonia also due to like a disease such as HIV, AIDS, or heart disease also, and smoking. Smoking is a really big risk factor. Smoking is not good at all. Smoking can cause your body's natural defenses to decrease and it not be as strong as they are, and it also just damages the lungs. In general, smoking is not a good thing to do, and I advise everybody not to do it. Some complications for having pneumonia, like if you're treated for pneumonia and you don't have it anymore, it's gone away, these are some side effects that you could get from it, like troublesome breathing and labor breathing. You could have that after you have pneumonia because you're not able to breathe as well as you once was. You can have affected fluids in your lungs. They're trapped under the inner lining of inner tissue in your lungs, and that stays there for a little while. And if you get like any pathogen that comes and infects those liquids, it could get the liquids sick and they could carry a disease. And those liquids could flow into the bloodstream, and as soon as the bloodstream, it could take you to a major organ such as the kidney, the spleen, and the pulmonary lobe, and that could cause you to have organ failures. So some preventions to prevent you from getting pneumonia is to cease all smoking. I know I talked about this a little earlier, but I really want to stress out that smoking is not a good idea and that you should just not smoke at all because it's a really big risk factor for pneumonia. You might want to avoid ill people that have respiratory viruses like the cold or the flu or chickenpox or anything like that, because usually after you get a respiratory illness such as those, you can get pneumonia as a result of that, as a complication. You want to wash your hands very often and just wash them good, like with warm water and soap, because it kills all the pathogens on your hands, and it just makes the world a better place and less disease-free. And getting the pneumococcal conjugate vaccine, you get that as a child, but if you smoke or you're over the age of 65, you might want to get that because it not necessarily prevents you from getting pneumonia, but it does prevent some of the complications that I did talk about earlier. So I looked at an experiment done by Perroth and many other scientists. they noticed that Streptococcus pneumoniae was becoming very dangerous, and that it was adapting to some of the penicillin and antibiotics used for that. The hypothesis was that the penicillin-resistant strand would actually not do as well against some of the treatments that they use, like amoxicillin, erythromycin, and many others. So they injected, what they did was they injected a random strain of Streptococcus pneumoniae into adult rabbits, and after their death they were dissected and they were looked into their organs were looked at, and they were sent to a microscopical lab, and they were looked at in more detail, like the pulmonary lobe and the spleen. The results that they got was they found that amoxicillin and HMR 3647, it did very well against strain 16089. Strain 16089 is a penicillin-resistant strain, and it found that amoxicillin and HMR 3647 did very well against that. They noticed that strain 195, which is a erythromycin-resistant strain, it noticed that it did very well too. Erythromycin, it didn't do very well against any of the diseases because it got the same results as the untreated rabbits. So some treatments for pneumonia are antibiotics and penicillin. They're not the most recommended ones, but you could get that. Cough medicine is good for pneumonia, but not all the way because you don't want to eradicate all coughing. You might want to get hospitalized and if you really get dangerous, and use an intensive care unit for that. So in conclusion, I want to talk about what pneumonia once was. It was a very dangerous disease that caused many people to die, and who knows what it might have become if it wasn't treated as it was today. And this pneumonia is a respiratory illness that infects the lungs with air sacs. This is what we talked about today. That is my citation.
Okay, in your experiment, you mentioned HMR 3/4 something. Could you explain what that is?
Okay, so that's basically a different antibiotic. It's called erythromycin, and that's just all it is. It's another treatment. Any more questions? AJ?
Is there a vaccine for pneumonia?
Yes, I actually talked about that in my PowerPoint. The pneumococcal conjugate vaccine is a vaccine you can get as a child, but if you smoke or you're over the age of 65, you might want to get that again because it doesn't necessarily prevent pneumonia, but it can prevent some of the complications.
Do you know the mortality rate for pneumonia?
I do not know exact numbers or anything, but I do know it is the leading cause of death for children under the age of 5 by a disease. I would have to do further research to answer your question.
Okay.